Hi, I'm Lisa Kamen, and I'll be moderating our session today as we discuss the concern over a growing movement across the U.S. by legislators and others to lower the professional standards that keep healthcare providers up to date. If you're like me, you probably assume that there are safeguards in place to ensure that our doctors, nurses, and other healthcare providers are staying current on research, advances, and information, but those standards that are in place are being threatened. We have with us today David Swanken, President and CEO of the Citizen Advocacy Center. We also have Ed Susank, a past and current board member of several healthcare organization boards. A grassroots group has formed called the Right to Safe Care Coalition. Both of you have decided to become active and participate in this coalition. Can you tell me what is the mission and the purpose of the coalition and why was it created?
The coalition was created in response to legislation that's been passed in several states and is under consideration in others that would undermine the effectiveness of the board certification system. We think that the existing process of rigorous, objective review is the best thing that assures members of the public that their providers, their healthcare providers, are competent and up to date. State legislators are being asked to abandon these rigorous systems, in effect to simply trust individual providers. Trust is a wonderful thing, but let's back it up with a system of verification. Our purpose is to build an alliance of like-minded organizations that support the concept of safe healthcare. We want to educate the public and other stakeholders on the danger that this kind of legislation poses.
Yeah, I think he covered it pretty well. One other point, it's an educational coalition. The public knows very little about the oversight system that we have today. Our feeling is if they get to understand the purpose of these programs that are in place, that's more important than understanding the nuances of what certification is, what licensing is. That's a hard sell. Safe care means, and quality care means up-to-date providers.
So why is it important for others to get involved in the Right to Safe Care Coalition? There's
an assumption that once you get health services from a doctor, a nurse, a pharmacist, anybody, that they are current and they're up to date. There's an assumption that the system is already assuring that.
I agree with what David says. And you know, anytime we talk about the delivery of health care, the patient is absolutely the most important stakeholder in the process. It's often their lives that are at stake. The state healthcare licensing boards do a very fine job qualifying providers for the initial issuance of the license, but very little attention is paid to the renewal process other than perhaps some requirement for continuing education. And there are at least 3 states that don't require physicians to take any continuing education classes in order to get their license to practice renewed. More and more, the systems now are looking for ways to extend this into the renewal process. And this has taken on a term called maintenance of competence. And we think the maintenance of competence system is the best way to assure the public that they can rely on this as a measure of quality.
Healthcare providers in some states and in some situations can have a license on the wall, but not have proven their continuing competency for years and years and years, and still have that on the wall.
What if you had your license for 30 years and you're a doctor? Probably 90% of the prescription medicines that are out there today didn't exist when you went to school. So the notion of measuring and requiring people to demonstrate that they're currently competent is really important. There's a lot of pushback by licensed physicians and other health professionals. Why do I have to do this? Why do I have to keep showing that I'm competent? Well, you know, pilots have to show every year that they're competent to fly. So there's plenty of other professions where the public is protected by these kinds of rules. Nobody has to like it, but I think that it's part of being a professional.
You know, the number of new papers, new procedures, as David said, the new prescription drugs and other types of therapies that are emerging are almost mind-boggling. And so, you know, as a layperson, as a member of the public, I don't understand all of those nuances, but I am relying on these professional organizations, these board certification organizations, these hospitals, the other healthcare plans to make sure that the people are up to date.
So how do programs that require demonstrations of current competence that are put in place by credentialing organizations or hospitals or state health licensing boards, how do those assure the public that our healthcare providers practice safely?
We have some evidence that the maintenance of certification process is producing valuable results. Improvements in HPV vaccination rates, improved care, improved diabetic care, control of blood sugar levels, improved care for people with hypertension. So there is a growing body of evidence out there. The certification organizations themselves are trying very hard to increase the amount of information, the amount of proof, if you will, the studies to demonstrate that these systems are making a difference, are producing better outcomes.
Well, thank you both for your insightful discussion today on this incredibly important topic. I think the movement to decrease the standards is critically important, that we understand it, that the public understands it, so we can fight against it to make sure that the public stays as safe as possible.